Hello, and welcome to the NHS Workforce Alliance Off Framework webinar. Thank you very much for joining. I know that it's a hot topic at the moment, but we're all very busy, so I appreciate your time. I'll start with a brief introduction to myself. My name's David Downey. I'm the Assistant Director of Procurement at the NHS Workforce Alliance, and I'm here just to talk to you about a few ideas about Off Framework in terms of the risks associated with it, but also how we move forward in terms of trying to get things on Framework. The plan for today is a bit of a welcome to the session and introduction to the Workforce Alliance, who we are and what we do. Apologies, some of you already will know this, but for the benefit of those who don't, I'll just touch on it briefly in terms of what support you can expect to access through me and my team and the wider regional teams also. We'll then move on to talk about the staffing pressures in the NHS, and they are well documented of late in terms of the vacancy rates, also the cost of agency staffing, and the risks to the NHS through those processes. We'll move on to Off Framework to define what is true Off Framework and sort of what are the causes to that. And then we'll talk about the NHS England National Programme of Works at the moment in terms of eradication of Off Framework. We'll then talk about some plans in terms of transitioning Off Framework spend onto On Framework and compliance spend. And then finally finish off on sort of risks and impacts of Off Framework agencies to both register staff, but also just look at the benefits of the On Framework supply also. So NHS Workforce Alliance, apologies, as I say, if many of you know this already, but we are the single biggest framework supplier in the NHS, and we are made up of 4 NHS procurement hubs that you can see on the screen there, but also Crown Commercial Services also. So in terms of workforce, if you hear NHS Workforce Alliance, we are it's the amalgamation of Crown Commercial Services and the 4 NHS procurement hubs. We started working together in about 2019 and have been very successful. And we're roughly at about 80 headcount at the moment, and we employ finance, procurement, HR, experts and also workforce category experts. Of late, we've recruited a number of clinical staff across medical and also across the nursing sphere. So I think we've got a really well balanced team in terms of not only procurement and contracting experts, but also people that have kind of lived and breathed in the NHS within clinical roles. So they give us a slightly different slant to that of procurement or HR. As I say, we are the single biggest framework in the NHS, and we manage spend approximately 1.5 billion, and sort of work with a lot of the ICSs across the country, not just in the east of England. Our role really is to help support you manage agency staffing, but also take a bigger holistic look at workforce and how we can support with things like international recruitment, some of the clinical priorities like the recovery of elective services, and how do we bolster the workforce in totality and make it a more stable environment and attractive for people to come and work and stay within the NHS. So we work with a number of stakeholders across the region, NHS England, HCSA, Department of Health and Social Care, and really our role in working with those guys is to act as advocates on behalf of NHS trusts and ICS systems. As I say before, the pressures in NHS staffing are very well documented. So it's not just about how do we access agency staff or how do we manage a bank. It's more about how do we recruit as a system and make sure that we retain our staff. So you can see from the right, it's all about a single solution to workforce within the NHS that's inclusive of both temporary and permanent and international recruits also. So challenges facing the NHS at the moment, supply, as I say, is really well documented. We've also got the added pressure of industrial action through nursing and junior doctor strikes, And COVID-19, quite frankly, was it was a catalyst really for staff burning out. They were already short within wards and departments, and it was difficult for them to maintain that level of work. So we saw quite a lot of staff, as you can see there, 140,000 staff left the NHS between Jan 21 and September 21. So that left a massive hole, and obviously the need to recruit and retain staff. But all that said, we are still a massive and very successful machine. So I think it's difficult to manage at times, but when you step back, the NHS actually is a hugely successful organisation. But we do have recruitment issues. We know that we've got an ageing workforce and population with 47% approaching retirement age within the next 20 years. So that is a void that we're going to have to plan for. And the work really does start now, or should have already started, in terms of what are we doing for that. If it's training in terms of bringing doctors and nurses through that kind of process, or if it's international recruitment, these things are costly processes, and also they do take time. So it's a sympathetic word, really, in the sense that we're working as hard as we possibly can do in the NHS, but actually we're still short of staff. So how do we do that? And that's kind of where the agency and the off framework comes in, because they do have a place and they do plug a gap. But actually the risk with off framework is something that we'll go on to talk about, really, as we move through the presentation. So in terms of off framework, the causes, already referenced the COVID-19 pandemic. It was really difficult when that hit, because it was a new thing and we didn't really know how to react. There was restrictions on where people could work or where people wanted to work. So that created a bit of a bottleneck in terms of having the appropriate resource that we could access. And also the number of patients increased significantly. So our ability to be able to deliver clinical services in the timely fashion and to the standard that we would expect became quite pressured, and we became unable to sort of service the same level of service users that were coming through the NHS doors. Another cause of off framework is the off framework supplier approach. So we know that within trusts that there's quite often a temporary staffing team or a workforce function in which they are solely responsible for overseeing, booking and implementing agency staff. The approach of off framework agencies is that they are aware that workforce teams are plugged into NHS England and plugged into frameworks, so they circumvent these processes and they go direct to wards and departments. Now that's not true of all instances. We do know that there are very specific cases where it's a strategic decision potentially to use off framework purely because you didn't have any other option. And it was the planning phase of recruiting staff didn't yield as many staff as we needed to. So there was a need to engage with off framework because there was no response from our own framework agencies. Quite often that does have an impact on cost and also on planning. So it's something that we're aware of, obviously, with all framework suppliers circumventing the process. So we might not actually be fully aware at all times as to what the size and scale of our off framework supply is. Gaps and rotas, again, it can be a strategic decision in the sense that, look, we just need to plug in some off framework on a temporary basis, and we will correct it going forward. But at the minute, there is a real need to get staff on the ground. And that idea that it is short term, quite often short term turns into long term, and actually our off framework problem is forgotten about sometimes because the staff are in there, they're doing a good job, and actually the clinical services are running quite smoothly, but albeit with staff that have been sourced off framework. So again, I alluded to it at the start. We'll kind of talk through the risks in terms of not having proper contracts set up with those staff and what the risk to you as a trust is. Again, lack of engagement from on-framework suppliers in terms of gaps and rotas. Quite often we hear from our trusts that, look, we've tried everything that we possibly can do through the on-framework route and we're not getting much of a response. How do we access further capacity off framework? And that misunderstanding really that off framework brings fresh capacity. Those candidates are very, very likely registered with on framework agencies, but we know that this is the approach of off framework really. Attractiveness to candidates. It's no secret that off framework agencies are typically offering higher rates of remuneration, and also the flexibility for staff to work across either multiple departments or multiple trusts and ICSs. So a candidate gets called by an off framework agency with a rate of pay that far exceeds what an on framework agency can offer them, and that does be sort of very attractive to them. So it's something that we need to be aware of in terms of what is our offer from the NHS out to our candidates versus what are off framework agencies offering, and how do we try to sort of close that gap. The next one is capacity within the NHS. Obviously, we are all very busy. You guys within trusts are probably doing 2 or 3 jobs at any one time. And it's difficult really to be able to juggle internal and external priorities. You've got multiple different stakeholders, as I say, trying to launch projects at various times, or there's elective recovery projects that are happening. So what is our capacity within NHS trusts to be able to react and design a process when something like COVID-19 hits, for example, which was a real catalyst for off framework. And then a simplified booking process. So off framework suppliers will typically, as I say, contact wards departments directly. It may or may not include contracts with terms and conditions attached, but the booking process from their side is very simplistic. So they try to make it quite easy for trusts to access that resource really. So again, it's probably just a look internally as to what does our booking process look like? How do we engage with our agencies? Do we make it as attractive as we possibly can do? And is it commercially viable long term? So the NHS England national programme to remove off framework. Initially, the objective was to get rid of off framework by the end of 2022. Now, whilst really good progress was made, we're aware that the market still exists. And there is further work to do in 2023. So they're committed this year to eradicating off framework, and we work very closely with the agency team over at NHS England. Effectively what their mandate is, and I think that's a hyperlink embedded on the presentation to the agency rules document. Their mandate is that you only use approved framework agencies that are approved under an NHS England framework. Where there's instances of off framework supply within a trust, they asked you to submit as part of your monthly submissions who the agency is and how many hours and what the rates of pay and stuff were through to them, so that they can come up with a strategy and work with the frameworks, frankly, to correct it. I will say that obviously we support the NHS England-Off Framework project and are helping to deliver that from a framework perspective, but they're obviously 2 different things in terms of the framework support and also the NHS England mandate. The other thing that they're very keen on, the inclusion, and the thing that they promote is the compliance with the NHS check standards and the need to audit the agencies. So the risk with off framework from an NHS England and framework perspective is that we haven't really done the balances, the checks and balances on these agencies. So we don't know if they're compliant with recruitment processes. We don't regularly audit these agencies. I know that some may sort of insinuate that they are audited as part of their own process and that they're fully up to date with NHS check standards, but we're really relying on them to mark their own homework to a degree, because we don't have the oversight really from a framework perspective. So we can't give you the assurance as NHS trusts that these off framework agencies are up to standard and meeting the same standards as we would expect from all of our agencies, and the things that we would look to pick up through our own audit processes. So that's a little bit in the NHS Off Framework project. Again, as I say, we do support that project from a framework perspective, and are committed really to helping you eradicate it if it's what you want in a controlled fashion. Moving on to the collaborative approach. It's a really agile market. The off framework suppliers quite often will be able to move supply across country. Really, we see a lot coming from Manchester down into the south and the east, and across London. So the collaborative approach really is whenever you buddy up with neighbouring trusts as part of your ICS, just to find out exactly sort of what their processes are, either internally or how they use off framework and what the risk mitigation is. I've used a diagram there that is, for me, off frameworks like a little bit of whack-a-mole. If you squeeze it in one area, as I say, it's quite a fluid market where they're able to just take the staff and move them to another region, another ICS or another trust. So actually it's quite unstable in the sense that if you've got a warded department that's entirely staffed with off-framework candidates, the risk is that they could be moved at short notice, and we leave ourselves exposed to risk because they don't have contracts of employment. Sometimes the notice periods within those contracts are not what we would expect in the NHS. So the benefit to using the NHS contract is that we would expect them to meet all of our standards. Again, the collaborative approach for us is really the way forward as part of the ICS conversation, so that we kind of reduce that risk of suppliers moving agency staff en masse across different trusts. If you're buddied up with the other acute mental health community trusts in your ICS, that allows you to compare sort of spend data by agency month on month. That allows you to pre-plan effectively for rosters and gaps in rosters. How can we help in terms of transition in the off-framework spend? So it's using us really as the NHS Workforce Alliance to help you manage this. Quite often when we speak to clinicians, and even the clinicians in my team, they get really nervous whenever we talk about transitioning or removing off-framework spend, because that could potentially have an impact in supply and our ability to be able to deliver clinical services, which obviously isn't acceptable, because with the NHS there's the need to keep the lights on. So we need to do it in quite a controlled, methodical manner to make sure that there's no disruption to our operations internally. And NHS England and we as a framework are increasingly using our routes into affiliated companies, for example. So if you've got an on-framework agency with an off-framework arm, and there are a number in the market, it wouldn't actually represent any kind of disruption to the agency supply. It would effectively just be a transfer of employment onto an appropriate framework supplier to ensure that you get all the benefits and sort of the protection that the framework offers you. In terms of the off-framework spend, sometimes the data can be misleading, and quite often what we see in the data is miscategorization, either at trust level or by NHS England processes. In terms of the submissions coming through, we know that some framework agencies have been reported to NHS England as off framework, so that's quite a quick fix in the sense that the numbers can be quite skewed because the data is inaccurate, rather than it being a true off framework problem or a strategic decision to use on framework. Another thing is that the on-framework supplier can come via an off-framework route. So, for example, if they're supplying nurses and nurses into the NHS, but they're only approved to supply doctors, technically that could be off-framework. But those kinds of solutions can be a quicker fix than somebody that is truly off-framework and not on any framework really. If we establish that the supplier is truly off-framework, then it's really a job for us as a framework to step in and support you as trusts and ICSs, which we're absolutely committed to do. So it's about the identification of the framework supplier has any on-framework affiliates, as I've already mentioned, and then it's about the planning stage. So how do we plan to move that supply over, taking into account there might be terms of business that apply in terms of the off-framework agencies, how loyal the workers are to the agency, and also what processes do we have in place in the trust to be able to move that over. So a full migration plan with timescales, and also risk assessing it the whole way through to make sure that actually we're never going to lose any capacity. And if we do, then we need to think through what a replacement to these off-framework suppliers would be, whether that be the staff or whether that be the supplier. It's also just something that we need to think through. Subcontracting is an option under the NHS Workforce Alliance framework. It does require some documentation to be completed, but for example, you've got an off-framework supplier that's been long-standing in the trust and you've got quite a good relationship with them and value the support. There are things that we can do in terms of subcontracting through an on-framework agency to ensure that you get all the benefits and the protections, as I say, as part of the NHS framework. because we wouldn't be sure as to what those terms and conditions look like. They're quite often bespoke, trust by trust. So if you look at notice periods, they could be longer, for example, or there could be higher rates of pay agreed, or different things included in there that we're not aware of. So subcontracting is an option, but in terms of the message to take really from this slide and sort of section of transitioning is that we absolutely work in collaboration with US trusts, ICSs, whatever the model might be, to make sure that the process is safe and agreeable, both commercially and also operationally within the trust. The risks of off framework. So obviously the NHS mandate is that you have to procure all staff via the on framework routes and approved suppliers on those frameworks. So the risk of accepting an off framework supplier is really the lack of certainty in terms of their financial stability, also in terms of business that they put in, and most importantly, the compliance checks that they do on the workers. I've already alluded to the fact that some may say that they do their own audits, but we don't know what that audit program looks like. So we're not assured that it still meets the NHS employers check standards. What's the rules around DBS checking and also references? So it's one of those things. It's a bit of an unknown really with an off framework agency, and quite often off framework is a rushed process because we've kind of exhausted all of the routes. We've tried to recruit substantively. We've pushed it out to the bank. We've pushed it out to our on framework agencies. They've been out there for a bit actually, and the roles are still vacant. So we need now to fill it via off framework quite quickly. So it's making sure that if we do that, that we've got all our checks and balances in place to make sure that we're doing all the checks on the suppliers and the agency that we need to make sure that not only the candidates are appropriately qualified, but also the agency is doing what they need to, and that they're financially stable and they're not just going to disappear overnight really. One of the other big risks that we've got with off framework is the signing of contracts. So quite often you'll get a booking form from an off framework agency and they will have terms and conditions attached to that. It's very difficult obviously for us to understand what's included in those terms and conditions. So my advice to trusts and ICSs is always be really careful. Please feel free to sense check things against me, my team, anybody across the Alliance before you sign anything, because there's a very good chance that there's something in there that wouldn't stack up against the NHS England standards within our frameworks, and also it just exposes you to a little bit of risk. Transfer fees quite often can be included, and typically as part of the framework it can be 4 weeks notice as soon as they've worked the 8th, but you often find with all framework agencies that these transfer fees and transfer periods are a lot longer and more costly to the NHS, so it's kind of disadvantaging yourself from being able to recruit properly. As I say, just the last comment in terms of the last minute high cost, that does have an impact in terms of the sustainability of many of these bookings. So benefits to using the on framework agencies, I've already kind of touched on it. It's the NHS terms and conditions. So these are set up and designed to offer you all the protection that you would need in terms of booking agency staff or engaging with other workers. There are also pre-approved rate cards. We know that it's quite tough out there to maintain compliance with these rate cards. However, there are various sort of things that make up the total hourly charge to the NHS. So it's things like national insurance. Are we compliant with AWR? Are we ensuring that we're not overpaying on the commission element to the agencies? So those are the things that are included in the on framework rate cards that might not be so visible or easy to get a hold of as part of the off framework cost. So as much as we appreciate the rate cards are difficult to adhere to 100% of the time, or in very specific specialties, it's one in which we try to manage through the rate cards, especially with all those other constituent elements that I've just talked about. Another benefit is the compliance process, so training and employment checks of all workers. We're very clear on what the standards are for the NHS and what we would expect our candidates to be compliant with. If they're found lacking, then you do have recourse under the contract to cancel placements, get rebates from suppliers, but also just the ability to be able to go in and check and give yourself absolute confidence that whenever candidates land within the trust, that they are suitably qualified and ready to work. That's something that we can't give you assurance on if there's an off-framework booking, for example. Audits is probably our USP and one of the big things that we do in terms of auditing the suppliers, not only about their own internal processes, but about record keeping, the ability to be able to evidence that their recruitment processes are robust and in line with contract standards, that they're checking references, DBS, and that they all comply with the NHS check standards. The only other thing that I really wanted to mention there is about the protection around critical incidents within trusts. Often you will find that these things pop up because we service such a huge area of the population, and things will happen. When that does, you want to be sure that within the trust you've got the proper processes and protection in place via contracts, liability insurances and things like that in place. Again, that's something that's untested and unknown really in the off-framework market, so we wouldn't be able to give you the assurance that this is absolutely safe and that you guys can rely on the contract from off-framework, because we've not seen them, frankly. So it's just a bit of a flag really that we don't want to ever imagine something goes wrong, but inevitably it will somewhere along the line, and you want to make sure that you're protected in the event that it does. The impact of using off-framework in terms of it destabilizes the workforce is what we see. So it creates one off-framework booking. For example, you put that off-framework agency worker onto the ward of the department. They will speak with their colleagues about potentially about what they earn, about the flexibility. It could sound quite attractive quite quickly, and actually it does have an impact then on staff who are quite happy working in substantive or bank roles within the trust or with on-framework agencies, actually migrating out and going across to these more attractive off-framework contracts, purely because it gives the candidate the freedom to be able to do whatever they like, rather than the trust mandating sort of what the rate of pay is, and sort of the activities within the trust. So that can be quite difficult in terms of controlling it really, because it does get out there as soon as off-framework agency workers start working within trusts that if they like it, we know that there are seasoned locums out there, so it's just a bit of a risk really, and it does have that ripple effect. It also inhibits the ability of sort of your own internal processes to be able to recruit, because we know that the off-framework agencies are offering more lucrative packages. So that's kind of the ripple effect in terms of an agency worker that comes in off-framework then starts to articulate the benefits without really articulating the risk to themselves or the trust, because it's unknown. We also notice that off-framework bookings are usually as a result of another cancelled shift somewhere else. So if they have agreed to work in the trust via off-framework, it usually means that they've cancelled the shift somewhere else, and we have seen that in very specific instances across the east of England. Risk to registered staff. I won't go through this in detail, but it's just in terms of the NMC code of conduct that your professional responsibility to be accountable for your decisions to delegate tasks. So if you have sort of staff in the trust in the department that have been booked off framework, are you absolutely confident going home at night that they're suitably qualified to be able to carry out the work that you know that you have to do in the department? So it's just that risk to registration really, and sort of the integrity of the trust in the department really. So as I say, it won't run through the codes, but they're there for reference if anybody wants some light reading afterwards. Here I've just sort of included some helpful resources. So there are some links to the reduction of off-framework case studies that we've carried out across the Alliance. We've done a lot of work here in the East and have had a lot of success. So we have the lowest off-framework spend in the whole country. I think it sits somewhere at about 11 million across the region, which is a massive well done to you and your guys that have worked so hard in the East of England. But the offer of support again is always there. Again, I've kind of sent a link to the NHS England agency rules in case anybody's not seen them. Very unlikely, I know, but it's there just as a bit of a resource. And then also the reduction in workforce off framework spend across various different regions across the country. So please feel free to tap into it really, if anything is useful. We're here to support. I know I top and tail that, but as I say, we're a not-for-profit organisation. We are internal to the NHS. I carry that lanyard everywhere because I'm fiercely proud of working for the NHS. And I think ultimately speaking, you should be able to come and ask for our support. It's not something that you need to be embarrassed about in terms of using off-framework supply. We understand that it exists. It's more about how we ensure that you're kept safe in those contracts, and also how do we stabilise the supply as we move forward. So obviously, feel free to reach out to me and my team. We manage 6 ICSs across the east of England and also 3 in the Midlands, but we do have national coverage across all 42, and it's bigger than just off-framework. We appreciate that quite often off-framework is the symptom rather than the cause. So if you do find that you've got a problem where you just want some advice or a friendly confidential chat, it's no problem at all. We're more than happy to help. As I say, we employ 80 people, and that includes clinicians, workforce category experts, finance, data experts. So if it's something that you need a hand with in terms of submissions or just want to compare, we're in quite a privileged position in the sense that we've got a bird's eye view of all the ICSs, so we kind of know exactly what the position is across the east and respectively across all the regions. So we're able to sort of say, well, look, this is what's happening in the trust next door, or if you're way out of kilter, then we can potentially look at sort of bringing you back in line also. But they're just our contact details. Whistle stop tour really of off framework. I doubt very much that I've said anything anybody doesn't already know, but just a plea really. If you are struggling or you're nervous about it, please don't feel restricted in terms of reaching out to us for advice and support, and we're more than happy to help. And as I say, we are by default extensions of your own workforce functions. We're in the NHS, we manage the largest framework, so it really is a pleasure to sort of support you in that endeavour really, and also advocate to NHS England on your behalf where things are getting difficult about reducing agency expenditure and those things. So thank you very much for joining, really appreciate your time, and hopefully speak soon. Thank you.